much for joining us here on Urban Debate on Mirror Now. I am Heena Gambhir. Sudden death of singer Krishna Kumar Kunnath or KK has brought the focus back on alarming rise in the number of deaths due to heart attack in India. Bollywood bid farewell to KK as his mortal remains were consigned to flames at a crematorium in Mumbai. He died of a massive heart attack post his performance in Kolkata. After seeing what happened with KK, a lot of us have said life is so unpredictable. Over the last few years, a few celebrity deaths have shocked the entire nation. Puneet Rajkumar, superstar in Kannada film industry, died at 46 in October 2021 due to cardiac arrest. Siddharth Shukla, known for his role in Balika Vadhu, winner of one of the most watched seasons of Bigg Boss and Fear Factor, died at 40 in September 2021 due to cardiac arrest. Chiranjeevi, another famous Kannada actor, worked in 20 plus films, died at 35 in June 2020. Cardiac arrest cited as the cause of death. Raj Kaushal, Indian director, producer and stunt director, died at 50 in 2021 due to heart attack. Amit Mistry, well-known theatre, TV and film actor, died at 47 in 2021, again due to cardiac issues. The list is quite long. But one thing that is common in all these examples is the cause of death, cardiac arrest. As per a paper published in India this year, the incidence of those suffering heart attacks has almost doubled in the last 20 years. And 25% of these people are below 40 years of age. Data from the government reveals that 7.8% of deaths that have happened in India in the year 2020 were due to heart attacks. Out of these, 2,695 deaths were among people in the age group of 18 to 30. 25% increase compared to deaths in 2014. 8,055 deaths were among people in the age group of 30 to 45 years. 19% increase since 2014. Among 45 to 60 years of age, the number of deaths registered were 11,183. 27% increase compared to deaths in 2014. Not just this, there's another study that I want to quote tonight. Global Burden of Disease study by University of Washington, Seattle has said that death rate in India due to cardiovascular diseases or heart conditions is 272 per 1 lakh people as compared with the global average of 235. So tonight, on Urban Debate, we want to discuss young and heart attacks. What's making the young vulnerable? What are the warning signs? And what is it that should be done in case of an emergency to prevent it? Joining us on the broadcast this evening are my guests. We have Dr. Heman Thakur, who is a senior physician joining us. Dr. Rahul Gupta, interventional cardiologist, Apollo Hospitals from Navi Mumbai, is live with us. Nisha Jamwal, celebrity columnist, is joining us on the broadcast. Sonia Bajaj, health and fitness coach, will be joining us. And Vandana Gupta, yoga educator and holistic wellness coach, also on the broadcast with us this evening. Thank you very much, all of you, for joining us here on Urban Debate on Mirror Now this evening. Dr. Rahul Gupta, I want to begin the discussion with you. You know, the first question is, what's behind rise in heart attacks, especially among young people in the country?
Rightly pointed out, there are so many, the statistics is quite dangerous and quite alarming. And the reason which I see is, we all know about, talk about exercise, we talk about diet, they are all important, but something which is often missed is about the stress levels, because you can't measure the stress levels. So there is a lot of pressure which people are undergoing, and they have a lot of pressure of performance, pressure of achieving targets, a lot of pressures, different kind of pressures. And the other one thing factor which I find in common is people are neglecting their sleep. So the quantity of sleep is also important. That's sleeping about 6 to 8 hours, as well as the quality of sleep is also important, which is often neglected. Like people who are say maybe a heavy snorer, and oxygenation is required for rejuvenation of our body, recovery of our body during the sleep. And if the quality of sleep is not good, if you're not achieving good kind of oxygenation in the body, this can also produce an inflammatory situation in the body, which can again produce make us more prone for heart diseases. The rise of high blood pressure, sugar, and high cholesterol is alarming in our country, and we are already world capital of diabetes, high blood pressure. So all these incidences have increased in the young, and that is why I feel that the incidence of heart disease is increasing significantly. So I feel that we have to detect
Okay.
these much early, and then start treating and evaluating them much early before they actually culminate into a blockages and heart attack.
Okay, how to detect them? That's going to be another aspect that we will be focusing on, but a little later in the debate. Let me also take the opening comments from my other guests. You have cited two important issues: stress, lack of sleep. Dr. Hemant Thakur, what is your point of view? What's behind rise in heart attacks? What's making India's young especially more vulnerable?
See, remember, heart attacks are predominantly lifestyle diseases. They are caused by lifestyle diseases. If you don't eat well, if you don't rest well, if you don't take precautions as far as all your regularity of diet is concerned, if you don't get your checkup regularly, and all you do is live on the edge of an accelerator where you're constantly having coffee, you're trying to meet deadlines, you're running from pillar to post, all because you want to do 25 hours of work in a 24-hour day. This breeds high stress, which breeds blood pressure, which breeds blood sugar. So when you have a boiling or a melting pot of sugar, salt, and butter, it's a perfect combination for the blood vessels in the body to get lined with plaques. And these plaques, either because of excessive fast heart rates or because of excessive metabolic stress, can rupture and go and hamper and close one of the coronary arteries. The cause of sudden death in young people is because in young people, there are no collaterals. Nature and time has not allowed the heart to sprout tiny arteries, which happens with age. There is no conditioning of the heart. So a 35, 40 or 45-year-old does not have the time and the natural ability to sprout collateral blood vessels. If he gets one clot, that becomes his last clot. You hear of people at 60 getting a first attack and 65 getting a second attack. But you hear of the younger people getting one and final fatal attack. Similarly, cardiac arrhythmias, the rhythm of the heart, is also governed by hormones and stress hormones, which is adrenaline and corticosteroids. These stress hormones also breed abnormal cardiac rhythm. So you can get myocardial infarction because of atrial fibrillation, ventricular fibrillation, which is why you may have read in the papers, and Mirror also has reported very correctly, that they have defibrillators, and couple of people who fell on the cricket field or on a football field were immediately defibrillated with the help of an electric shock. So these things are conducive in the young people. They breed this because of their lifestyle. Indians have a genetic propensity, as Dr. Gupta said, to high sugars, to high pressures. They are fat, they are apple shaped, their abdominal opacity is large. Their idea of fun on a Sunday is not to go rowing, riding, or polo playing, or even athletics. Their fun is to party late at night, eat all the wrong things, sleep at 4 in the morning, snore your way, and then ruin your Sunday. We have to alter our lifestyles. And this is most for our younger people.
We have to alter our lifestyles. Those are some very important points you have highlighted, Dr. Heyman. But Nisha Jamwal, we have also seen young people, fit people, those who hit the gym regularly, those who follow a schedule when it comes to eating and, doing certain activities to keep them fit have also died because of cardiac arrest. And that's the reason, tonight we are having this debate, because of late we have seen many such cases emerging in different parts of the country, and the nation is shocked as to what is happening. A person who looks absolutely fit and fine, who follows a good schedule, suddenly passes away because of heart attack, cardiac arrest.
I couldn't agree with you more. It's way more than just lifestyle and healthy eating. I blame, I blame FOMO. I blame doom scrolling on social media. I blame the pressures on the modern existence, especially of high-profile lifestyles. You named a lot of people who were high-profile people. Another very rampant trend we see is wanting to be thin, unnaturally slim, keto diets, diets that are not natural, excitement, a seeking of excitement through drugs, through uppers, an unhealthy amount of caffeine in one's diet, the desire to look slim all the time, performance pressure, the pressure to, constantly post a DP where you're happening, you're with it, you're part of the jet set in the world. There isn't anything like silence, personal space, time out, a vacation, because people start getting stressed about not attending every important social activity, social happenstance in a city, in a metro life. The life in a metro, in a city like Bombay, New York, Tokyo, life is very similar. It's very stressful. It's a high performance life. And like I said, social media brings that level of FOMO where you feel left behind. As you grow older, you begin to feel more and more panic about the fact that you've been left behind on the shelf. I see it around me all the time. I worry for people having early heart attacks. Early heart attacks is statistically something we see of late in the last few years, and it's only growing worse with the absolute stress of being out there, being seen, being with it, and being in the public eye.
Okay, fair point. Those are very important issues that you have raised. Vandana Gupta, what is your assessment, in your opinion? Because of COVID, we have also seen a lot of people taking to yoga, being more alert when it comes to fitness levels. Yet, according to, for example, NCRB data that I have with me, deaths due to heart attacks have gone up by about 53% in 5 years. What's the reason in your view?
Like all the other columnists have said, just said that there are many reasons: lifestyle, stress, eating habits, and of course the weight loss obsession, which just Nisha said, that all they want to have a quick fix. They probably hit the yoga mat once in a while. They just feel that if they are doing thrice in a week's time, this is it. How the Dr. Hemant said that on the Sunday or a Saturday, they just drink all the wrong food, eat, and just ruining their Sunday or their weekend, not at all doing any athletic activity. Exactly same thing is happening with the yoga also. If people are coming to us for thrice a week also, they think this is it. Now we are all safe, because they don't want to be actually fit from within. They just want to be safe. And in that mindset that I want to be safe and thin, so hitting the yoga mat thrice a week will work for me, but it is not actually working in the deeper way. So people comes, hit the mat, do all the yogasan, but not focusing on the pranayam. How the Dr. Rahul has said initially, that how beautifully you have to have oxygen in your body to actually, for all the internal organs function properly. If you have a lot of oxygen in the body, then only all the internal organ will work and function properly. If this is not happening, I have seen in my classes also, people come, they do yoga, and when they ask them to lie down for final relaxation, do shavasana or pranayam for 5 minutes also, they just want to run out of the mat. This is also one of the biggest reasons, because mentally they are not present. They are only there to lose weight because of this obsession of weight lose, as Nisha said, that because of the social media sheep-like behavior, that okay, somebody is following this diet, somebody is following this yoga, the power yoga, ashtanga, hatha, blah blah blah, just to lose weight. And this weight loss obsession is actually especially in the youngster, we have come to a point where people are actually not focusing on their inner health. They just want to do a quick fix, which is not happening. And because of that, a lot of stress is coming. So there are a lot of stress, not just mental, it can be physical also. And with the mental and physical stress, the heart is not working as properly as it should because of the lack of oxygen, a lot of stress, lack of sleep. And I think this is one of the major reasons. That's how the rate, like 53% you have just mentioned, have increased in India.
Absolutely. Dr. Hemant and Dr. Rahul, now my next question is to both of you. Is this being seen only in India, the trend that we are discussing right now, or do you think it's a global phenomena in this particular age group? Dr. Rahul first, then Dr. Hemant.
Yeah, so it is being more seen in developing world where there is a lot of, the growth is happening. There is more pressures, as all of us are pointing it out. What I'm seeing in my clinical practice is very young generation coming with high blood pressure, with high sugars. And as rightly pointed out with all of us, that people are into social media and the parents are complaining about the kids watching and looking at the social media late in the night. So they're sleeping and everything is going down. And the phenomena is being seen everywhere globally, but India is surpassing all the global averages. That is the most worrisome part which we have been observing, and we are seeing as young as in their 20s also coming with heart disease. Today, in fact, in today's clinic also, when I was attending just now, I saw 5 patients below 40 years of age who have suffered heart attack, and they just came for the follow-up. So the trend is quite alarming. It was seen more in the male population, but I am seeing now the females also are catching up. Usually females were protected before their menopause with their hormones and all. But now we are seeing that the females are also catching up, and we are seeing younger females coming with heart disease. Probably, again, the lifestyle changes which have occurred. Females have started smoking more as compared to what was there in the past. Same kind of pressures, lack of sleep, more stress. So this is what my observation has been. And even the statistics are saying that India is above the global average in terms of heart disease being seen in the young population.
Okay, Dr. Hemant?
I would take a little different view and echo the same sentiments. In India, there is a stress to perform. There is a stress of the desire to be everywhere and to be successful in every field. You want to be the best in the office, bringing in the best of profits, maximum. You want to be the best looking as far as the offsite is concerned. You want to see that your dance is perfect, that you also have a V-shaped contour. You want to be in with everybody where you can have your tequila shots and you can smoke your cigars. And at that time, you feel a pang of guilt and you want to go home and also party with the family so they don't feel left out. So you want to do everything together. And that stress makes them burn the candle, not at both ends, but burn the whole candle. And it is this burning the whole candle which ignites the body's metabolic rate to a complete volatile state. And we are forgetting that 1/3 of the day should be gone in allowing anabolic, makeup, sleep. Unless you don't rest, the physical muscles, the involuntary muscles, the organs, the brain, the endocrine system, all that is ticked off constantly. So rest suffers because you want to be everywhere, you want to do everything. You do not, as one of our colleagues said, you don't want to be left out, and you want to be the best. And this is more in India. The Indian student, the young executive, and the aspiring managing director wants to show everything that he's the youngest executive of the block at the age of 40. This does not necessarily happen in the West because they decide either you're going to do physical work like javelin throw and swimming and rowing, or you're going to study and go onto a microscope and work in the lab. In India, you want to be everywhere. So this lays a lot of stress, along with the genetic factors that the poor Indians have high sugars, have short, stubby features, which gives them a short stature, and they have bad arteries and a genetic history to metabolic diseases.
Hmm. Genetic history, that's also an important point. And I also want to talk about what should be done. But before that, let me take the opening comments from two more guests who are joining us on the broadcast. Bhuvan Punana, who is an actor, is live with us on the broadcast this evening. Good evening. Thank you for joining us here on Urban Debate on Mirror Now. What will you say about how we are seeing increase in number of deaths among young specifically because of cardiac arrest, because of heart attacks? What happened with singer KK? Nobody had really expected. He was performing in Kolkata and suddenly we get this news that he has died because of cardiac arrest. What is the reason? Lifestyle issue has been cited by the guests so far, but what will you say? The stress levels, the way they are high right now, is it something that we are doing this to ourselves, or there's more pressure from the outside that's leading to high stress levels? Okay, we'll try and reconnect with him in just a bit. But Dr. Hemant and Dr. Rahul, I also want to talk to both of you about the symptoms to watch out for. We have, okay, we'll go across to Dr. Hemant in just a bit. But Dr. Rahul, I want to talk to you about the symptoms specifically. What are the symptoms that one should be, careful about? Can we prevent it? Can we watch out for certain changes in, how we are going about during the day to prevent a heart attack?
Yeah, so, there are typical symptoms and the atypical symptoms. Typical symptoms, all of us know, and atypical symptoms sometimes can fool us. So, typical symptoms are, heaviness in the chest, choking in the throat. All these symptoms which come on exertion and go away with rest could be a symptom of heart disease. Certain symptoms like tiredness, breathlessness on exertion, they might be missed out thinking, that it may be something else. But, these are the symptoms to be watched for. Somebody who was quite energetic and now starts feeling tiredness on walking, exertion is something which should, ring the bell. Similarly, there are atypical symptoms. Some people, they present with pain in the jaw and they end up with dentists. Some people, they present with pain in the neck or back or the upper part of the stomach area, where they consider it to be something different. But if somebody is getting, the key point is, if somebody is getting discomfort on exertion, suppose they are walking or climbing stairs, which they were usually able to do easily, and now they are finding it difficult and they are developing these exertional symptoms, should be something which they should be alarmed of, and could be reflection of blockages in the heart and maybe some alarm symptoms. So a lot of discomfort which was not there is now coming. Some people, they consider burning as acidity problem, but acidity, gas problems, acidity problems and heart problems, the symptoms can actually match. So my recommendation and my suggestion would be, anybody who's experiencing symptoms which they had never experienced before, they should immediately go, because most of the time we will get some time before actually the heart attack happens. These alarm symptoms might be there, and therefore this is the time where, if action is taken, diagnosis is made, we can actually prevent a person developing a heart attack, because timely action would have been taken by that time. So these are certain symptoms to be watched for.
Okay, those are some important symptoms you've spoken about. Let me also now take the quick comment from Bhuvan Punana, who is an actor joining us on the broadcast as well. Sorry, we lost you earlier, but what will you say about how there has been an increase in cases of deaths because of heart attacks, specifically among young people in India? KK's death clearly has come as a shock for the entire country. He was performing in Kolkata and suddenly we get to know that he's died because of cardiac arrest.
Absolutely. First of all, I think that there are, I personally think that there are two important reasons for this. The first being unrealistic expectations, like in today, a kid watching a film or watching something on the TV wants to get that body, wants to create that muscle in 2-3 weeks. Whereas the person who is watching has been through that, doing that for years together, and he's got that physique. And, one thing is unrealistic expectations. Number two is, I think, we are eating chemicals. Yeah, today whatever we eat, whatever we drink, it's all filled with chemicals, and the air we breathe is so polluted. And along with all this, when my parents were young, for them, a heart disease or diabetes or a BP was an old man's disease. But today it's everywhere because our lifestyles are such. I get up in the morning at probably at 4:15 in the morning. I'm working till 6:30. I'm shooting till 6:30. 7:30, I go for my workouts. I'm working out till 9 o'clock in the night. 9 o'clock, one of my friends calls me and says, "Hey, let's catch up for a party. It's my birthday." So I party till 12:30 in the night or 1 o'clock in the night or probably 2 in the night.
So it's a choice that you are making as an individual.
Absolutely, absolutely, and it's a choice. But in this particular competitive world, where we all, as one of the doctors was saying, we all want to be number one. There's huge competition of being the best, looking the best, and there is no more competition within your own self. It's not like you're trying to improve. You're trying to be the best, but you're targeting another person. You're looking at another person and saying, I want to be better than that person. And you want to do it immediately. And our bodies, our organs are, created to take a certain bit of, pressure, a certain bit of, weight. But when you're overstressing your heart, your lungs, your liver, your blood flow, you're overstressing it. You're giving it too much of, 2 times the work of what it's supposed to do. It would stop functioning at a particular point of time. So I think it's a combination of all these.
Absolutely. There's too much of stress, too much of pressure. That's something that needs to be addressed, that needs to be tackled now. We have Nawab Faizi, fitness trainer and Anglo-Persian model, also now joining us in the broadcast. Good evening. Thank you for joining us here on Urban Debate on Mirror Now. We see, people these days being very conscious about what they are eating, whether they are going to the gym on time or not. People, have been quite aware of the fitness levels that they need to maintain in whatever profession they are today. So what is the reason, in your opinion, that, young today are getting so vulnerable? Is it because when they go to a gym, they probably, want to do everything, they want to achieve their goals very fast? Can that be the reason?
I would say that because the entertainment industry and let's just say the celebrities and everything have set a very unrealistic point in fitness and everything, that when youth and everybody thinks that if you want to become an actor, a successful actor, you got to look a specific way. And these are unrealistic because these guys are like professional. They hire professional trainers. They're on chemicals and everything, anabolic steroids. And what happens is that when they're able to afford that, they can get like full body checkups and make sure that somebody is, looking through their blood and everything, make sure that they're fine. But what happens when the youth gets inspired by this, they want the same thing because, let's just say for an example, Amir Khan had a transformation from Dangal where he was like really fat and he lost all that fat and in 3 months he got transformed. So everybody goes like, if that's natural, if he does it natural, then it'll be possible because he's human and I'm human and I'll be able to do it as well. But this sets a very wrong example out there. They go to the gym and then they find some coaches and like in local gyms and this and that. And then they offer them anabolic steroids. They do get results, but then all of this kind of leads to an unhealthy lifestyle. They get habitual to it. They look at it, they see quicker results, and they go like, yeah, you know what? Like a drug, they get addicted to it, and then they keep doing it. And like at a young age, they have liver problems, heart problems, kidney problems. They have stamina problems. all of this really is something because of whatever the celebrities and more recently this guy KK, the singer. I wouldn't say like there's a lot of Bollywood actors who are like currently on these chemicals, the party drugs and everything and all that. Kind of like because it's a setup that Hollywood has set the standard over there that every Hollywood actor wants to perform really well or some chemical drug, and that's what helps them perform well. But then sometimes
Well,
some
absolutely.
people
Those kind
abuse
of
it.
pressures we know and have been discussed on the show as well. And Dr. Rahul Gupta, now talking about how to prevent a situation like this, what can be done in case there is an emergency? And how do we differentiate between this feeling of a heartburn or, some sort of a heart attack? Because usually if there is some problem within, one gets to an antacid and then, when things look better, one forgets and then moves on. So what, according to you, should be the first response at any given point in time if there is some sort of, inconvenience that one begins to face?
As rightly said, people are fearful of raising the false alarm. They are, they feel shy if I create a false alarm and what people will say. So the most common reason for death after symptoms is delaying in taking the action. So the most important thing is, as I told you earlier, if somebody feels something is unusual, it is, either they have suddenly started feeling breathlessness or palpitations or choking or burning, which they sometimes consider as acidity and they continue to delay their treatment. The best thing to do is go to the nearest possible center and take an electrocardiogram, the ECG. Because if there is a symptom of heart disease or the heart attack has happened, the ECG will definitely show changes. And at the same time, if there is a discomfort and the ECG is normal, it is very unlikely to be a heart attack. So this is the most important thing. Suppose a person is not able to reach a hospital immediately, Disprin is something which everybody has, it's easily available. It can be chewed, even if it's a false alarm and Disprin people have been using for headache, they can chew on Disprin. But the most important thing is reaching and taking a medical attention, getting an ECG done, because that is something which will tell us immediately whether it is a heart attack or not. And then a timely action, because there is a concept of golden hour. If a person reaches a hospital within the golden hour, actually he can get treated very well and his heart function can be restored to normal with the kind of treatment which is available these days. So this is the most important thing which is to be done whenever there is a suspicion that this could be abnormal. So don't worry about feeling shy that you have raised a false alarm and what people will say. Take immediate action, take an ECG. So this is the thing which we have to do. And then there is something, which yes.
Yes, go ahead, sir.
Yeah, so the first part of the question, this was the second part. The first part is how to prevent heart attack and how to become yourself a heart attack proof. So I always say there are 6 E's which are to be followed. And if these 6 E's are followed, we can literally make ourselves heart attack proof. So the first E is exercise, and there has to be all kind of exercises, which is like cardiovascular exercise, toning exercise, and stretching exercise, because every exercise will have its beneficial impact. Then about the eating habits. Now in the eating, we all know what is junk, what is good, what is bad. We have been talking about it. So good and bad food is important to understand. We all have to eat the healthy stuff most of the time, but eating timely and eating in a peaceful manner is equally important, because if you are in a hush, if you are in a rush, and if you are just gulping your food down, or if you are taking at erratic times, like taking a late dinner and all, is all harmful to the body, because then the inflammatory activities get activated. Third is your emotional health. And it is very important, because if you are emotionally happy, optimistic, and positive, whatever the situation may be, it is good for your body. But if you are emotionally stressful, it again triggers the inflammation in the body. The fourth is exiting addictions, smoking, tobacco, excess alcohol. All these are putting our body at tremendous amount of pressure and inflammation, which causes plaque formation. The fifth E is enough good quality sleep. As I was speaking in the beginning of the show, that enough 6 to 8 hours and good quality sleep. And the sixth E is, which is the most important, and the reason why the heart attack is still rising, despite all of us knowing that what is important and what we should do, but still the heart attack is rising, is evaluating your risk factors on regular basis. And what are these risk factors? These are all your numbers, your
Right.
blood pressure numbers, your sugar numbers, your cholesterol numbers, your waist hip ratio, your weight, because these are all silent killers. The unfortunate part about the heart disease is that all the risk factors are like a silent killers which do not produce immediate symptoms, because suppose there is a pin which is
Yes.
pricking, you will take immediate action. But these risk factors, they are very, very silent, and they can be known only if you check them. So in this busy lifestyle where we are, trying to do our best and running around, and sometimes we miss that fine line of work versus overwork, because we are passionate about our work. So we overwork and we don't realize that we are harming the body. And the only way to know is checking these factors regularly. And if you find one, we don't have to get worried. We have to just take action so that we can. And if we follow the 6E, it has been shown to reduce the chances of heart attack by almost 80%. You can make yourself literally heart attack proof.
Oh, wow. I mean, I think that's a very, very important list that you have given to our viewers. I'm sure it is going to be very, very helpful as well, because we can't really wait for symptoms to show up. We need to prevent it from happening, because like you said, sir, that this is a silent killer. Nisha Jamwal also wanted to make a point. Yes, go ahead.
I wanted to add to the emotional aspect, because in a transactional world that we live in, especially in high performance careers, in celebrities, famous people, relationships are not in depth and real. It's about transactions. It's about what you can get out of people, real relationships, emotional succor, one-on-one conversations, true confidences give you that level of emotional strength, which also help you circumvent stress, agitation, anxiety, panic attack, which subsequently lead to things like, heart attack and even suicide. They're both, as rampant in the current age, and we see it only increasing. We don't see any mitigating factors in cities. It's only getting worse. So I want to say that real relationships, friendships, confidences, counseling, meeting a psychiatrist are not things that we should gloss over.
Well, absolutely. Vandana, what is going to be your advice to the viewers who are watching you right now? What should be done if they are going for a yoga session? They should take it seriously, isn't it?
So since doctor and my other panelists have said a lot of things, so I'm not coming back to the things again and again, over and over. I will only suggest, whenever you are opting for any kind of physical activity, be it a gym or any kind of outdoor activity or even yoga, please don't come with the mindset of short-term or the quick fixes, because there is no quick fix in life, be it the physical health or emotional or mental health. Along with that, I will just suggest a couple of asana, which is very, very good in the cardiovascular health, for the cardiovascular health, as well as some pranayam. And please, whenever you are going for a yoga class, stay till the shavasana, because that actually works on the mental health along with your physical health. So I'm just telling you some very basic asana. These are those which actually help in directing the blood flow towards the heart. So thereby a lot of proper blood flow towards the heart for the arteries as well. So it's a very simple Surya Namaskar, a sun salutation, which is an excellent cardiovascular. It's a combination of 12 asana. If you are doing it properly, it's an excellent cardiovascular, and it doesn't only work on the physical body, it actually works on your mental body also, calms your mind. Its stress level also comes really down if you are working on the Surya Namaskar properly, along with the breathing technique. So if you are doing pranayams like Dirgha Pranayam or a Samavriti Pranayam or Nadi Shodhanam, if you are doing Samavriti Pranayam, if you might not know, it's just the equal breathing in English. These means the three-dimensional breathing, where we use actually our abdomen, our lungs, the full capacity of lungs. So our lungs and the clavicular region. So three-dimensional breathing, it actually very nice. And if you can do such pranayam with the retention, I meant if the retention of your breath, if you can do
Right.
that, it actually gives the availability of the oxygen to come in the contact with the blood and stay there for a little long. And as I mentioned earlier also, this is the wonderful opportunity for the blood to have a lot of oxygen and for the function, proper function of our internal organs. So if we are doing the yoga class, please, yoga is not a remedy. It is actually a lifestyle. We've been talking about the lifestyle over and over again. So yoga is not just the yogasan or pranayam. It's actually about the right eating habit, sleeping well,
Right.
mindfulness as well. So if you are mindful about all your things, stress will be reduced. We are living in a material world. How the other people also said that stress is a byproduct. It will come. I'm not saying stress will not be there, be it from the relationship which we have or the physical activity which we are going to do. So physical kind of a stress, if some kind of pain is there, there will be physical stress, professional stress. We are in rat race.
Right.
So social media, we are in red race, professional, that we are
Yes.
not working well on the
But it's very,
platform.
very important to look after one's health, and you all have given some very, very important tips for our viewers as well. I'd like to thank all of you for joining us here on Urban Debate on this very, very important issue this evening on Mirror Now. With this, we will slip into a very short break, but there's lots lined up for you on the other side as well. Stay with us.